and this is kind of participating right here. Anyway, no one knows. Even those that were in the class there earlier.
I feel like it's cheating because I heard the answers already.
So what is it all about? Help me out. I want to see how well I did this morning, at least.
Well,
What are we talking about?
Trying to encourage employers to provide health benefits and make the options more affordable to individuals and give them more options to obtain coverage.
Now that's for those of 50 or below, but those of you that have 50 or more, why do you offer health care insurance now? There were a lot of hands up, but you're kind of quiet.
Competitive advantage.
Is that why you're offering health care insurance? Or are you just kind of like good guys and gals?
Good thing to do.
Huh?
It's a good thing to do.
Good thing to do.
Keep good staff.
Keep good staff. What else? Okay, so businesses with less than 50 employees make up 96% of the businesses in America. And they typically have not been able to offer health care insurance because they couldn't competitively afford it. While businesses with 50 or more generally have been able to afford it, those with 100 or more definitely have been able to afford it. And because you can afford it, you're offering it so that you can retain the investment that you put in for your new employees, to train them, teach them, guide them, supervise them, mentor them, but also to retain them because of the benefits that you're offering. That's generally how it happens. I mean, you know, we apply for a job, you know, we send our resume, get an interview, and we get a call from HR that says, congratulations, Mr. Peel, you have been selected for this position. We're going to pay you X amount of dollars. What's the second question? What's the first question I have?
What are the benefits?
What are the benefits? And mainly I want to know about health care benefits. You know, the other things are good, you know, vacation, you know, sick time, but what I'm really looking for is my health benefits. So here we are, you know, 2013. One of the biggest issues for potential employees is that they're choosing where they're going to work, not necessarily because of salary, but because of affordable health care. Their ability to be able to get health care because their employer is sharing in those costs. That is one of the number one reasons that employees select companies, which is why they have selected your companies, most of you. And we'll talk to the few of you that do not offer at this point, okay? So currently, you know, small businesses and, you know, including you, may be paying anywhere to 18% more on your premiums than major companies like Honda or Toyota may be paying, because you're paying a lot in administrative costs. You may be paying anywhere from 60% of your premiums are going to administrative costs. That's going to change now with this Healthcare Reform Act, and I'll talk a little bit about that a little bit later. So basically, including those that did not put up their hands, these are some of the the obstacles that you have faced in offering healthcare. You know, too few choices, high premiums, you know, there's high group rates if you have a lot of women or elderly working in your organization, and for chronic illnesses, and there were long waiting periods, or, you know, there was no coverage for pre-existing illnesses. But now, as the Affordable Care Act comes into place, the insurance companies have a shared responsibility in this Reform Act. In fact, they've got the biggest. So a lot of the apprehension is coming from the insurance companies because they're trying to figure out, with the monies that they have to pay to fund some of the things that are happening, they're trying to figure out how they can pass that on, you know, to the employers and their premiums. So there's a little thing going on right now in the legal community about what's going to happen to these companies that are raising their rates right now before they get to those caps of where they can raise it in 2014. So today, insurance companies face administrative spending limits. So with the Affordable Care Act, they will now have to spend 80% of your premiums on your health benefits or to improve the quality of your health care. Currently, they may only be spending 40%, and the rest of it is going to administrative costs, and the majority of that is going to bonuses for CEOs. So the government is changing that and saying, hey, you no longer can do that. You're going to have to spend 80% of those premiums on the quality of care and for reimbursements for payments of those premiums, or you will face a rebate situation. I'll talk about that in a minute. Starting in 2014, they must disclose all hikes to their premiums that exceed 10%. If you follow the industry over the years, that's been unregulated. You know, they've jumped for anywhere from 15 to 30 to 100, and it just keeps on going. So they'll be capped that they can only increase starting in 2014 by 10%, and they'll have to justify to the government on why they're increasing that. Now, how that works, what criteria the government's going to utilize, I don't know. But that's what's going to happen. So now, guess what's happening today? Insurance companies are, looking at raising rates. I've heard numbers, the premiums are going to exceed over 100%, 116%, and that's coming from the insurance industry. So I need to preface that. But however, there is this discussion, negotiation, compromise government. And this compromising that's going on to deal with the insurance companies trying to figure out how they can pass those increases in what they're going to have to share on to you. So starting in 2014, they can't charge higher rates or deny coverage because of chronic or pre-existing illnesses. For someone like me, if I was just getting into, health right now, into healthcare, they're going to ask all these questions. Do you have high blood pressure? Do you have diabetes? How much do you weigh? Can you see? Can you go to the bathroom correctly? I mean, the myriad of questions, because it's creating what we call a risk assessment on me being covered. Well, with small businesses, you have a hard time trying to spread, that risk coverage over your employees. So if you have a lot of women employees that are of childbearing age, your risk rate goes up. If you have a lot of elderly, your risk rate goes up, so your premiums go up. That's how it's calculated now. They're no longer going to be able to do that starting in 2014. Can't charge those higher rates. Basically, they will pool risk instead of your individual business. And I have to be careful when I say your individual business, because depending on how many employees you have, this may not actually pertain to you. But they will have to spread that risk amongst several hundred different small businesses versus one individual business. So the premiums should be able to be reduced because the risk pool will be spread out. And all plans will have to offer these essential benefits. Those of you that already have health care, you already have essential benefits. I will almost guarantee that. You already have those essential benefits such as preventative care, ambulatory, emergency room, prescription. So all of your coverages should already have this minimal essential benefits. So all insurance companies are going to have it. Your insurance companies are probably what we call grandfathered. If you have not made any changes since April of 2010, I'm getting my numbers mixed up. This is going to be my helper, by the way, here, because he came up with some good questions at the end. He challenged me. I won, but he challenged me. So, no, just joking. So, 2010, if you haven't made changes to those policies or that coverage, your plan is grandfathered. You're okay. The plan that you're offering meets the requirements of the employer share responsibility. Was that the end of that? I'm sorry.
I guess
Okay, thank you. You're good. So this is not going to pertain to you because you have, over 50 employees. Basically, we're just talking about some of the advantages and some of the impact that the Affordable Care Act is already starting to take place. 6.9 million young adults have coverage through their parents. That age now is probably around 24 if they're in college, is going to go up to 27. So all insurance companies will have to also cover your children to the age of 27. I know when I was growing up, I think my children were covered to age 18 while they were living with me, or 21, or up to 23, depending on whether they were in college or not. After that, they were on their own. So basically, there's some coverage now till age 27, as they can get established into workforce, and they can be covered under their parents' plan. 17 million children can no longer be denied because of pre-existing illnesses. So, you have children that were born with kidney deformities or autism. Insurance companies were denying coverage. They can no longer do that. 6.1 million seniors have saved over $5 billion in prescription costs. And this is a big one, the electronics records reform. So we had a little bit of discussion about this earlier, I think from my buddy, right? That's about the electronics reform, records reform. So basically what's happening is that the government is requiring the doctors, the hospitals, the insurance agencies to all do everything electronic. That is supposed to significantly reduce administrative costs, expedite claims, etc. So this is kind of some contention right now of who's going to absorb those costs. Mainly with the smaller businesses. However, for you bigger businesses and stuff, you should probably get in touch with your health benefits people and try to figure out how that's going to work, because they'll be getting the softwares, or your payroll people, they'll be getting softwares that are being developed that will be able to help you with this. And of course, my friend Donna back there, who is a health benefits expert, is probably a good person for you to talk to if you have individual questions about individual situations as they pertain to your individual business, because it's going to be difficult to cover every scenario and situation from here. All right, so how does this impact businesses? Right now, we're only talking about 50 and above, because below 50, there are some incentives that are out there, some tax credits for them to be able to purchase healthcare insurance that is affordable, that they have not been able to do before, so that they can be competitive against you. So instead of them growing folk and teaching folk, paying them a competitive salary, as soon as you offer them a job, or major companies offer them a job that offer healthcare benefits, guess where they're going to go? Which is the reason why you're offering healthcare benefits. I want to make sure this is the right slide, because they're not eligible for small business tax credit or the marketplace. So I think you might have the wrong one up. Excuse me just a second. Everyone take a break.